Good evening, dear students. I'm Dr. Sujatha, obstetrician and gynecologist. Today, I'll be taking up your webinar. When they put up the request for what topics you wanted, I saw all the 4 topics and I knew immediately you would choose for PCOD, and that's what happened. It's nice. We'll be discussing about what is PCOD. Let's decode PCOD step by step. Okay. So what is PCOD? PCOD is polycystic ovarian disease. So this is an overview how I'll be taking through in this class today. You will be, one sec. You'll be going through what is PCOD, then the pathophysiology and other signs, symptoms, and to prevention. So what are the common myths that you see in PCOS or PCOD? So is PCOD the same as PCOS? Then is PCOS a problem of the ovary? Is PCOS seen only in obese girls? Is PCOS women difficult to get pregnant? Is PCOS completely curable? And is surgery an option for polycystic ovarian disease? So let's go and see how I'll dispel all the myths. So polycystic ovarian disease, like how you have heard many times over the past few years, polycystic ovary disease is an old nomenclature. That means it was an old name, and the new name right now is polycystic ovarian syndrome. What is polycystic ovarian syndrome? That's what I'll be talking about. PCOS in the coming slides. I'll be talking more on PCOS. PCOD is an old name, so we'll not use that any longer. So PCOS is nothing but where a woman or a girl experiences irregular cycles. That is because of anovulation, as you can see here, and an hyperandrogenic state, that is abnormal facial and body hair, which cannot be explained by any other reasons. So that is when you label it as PCOS or polycystic ovarian syndrome. So PCOS is not a problem of the ovary, but it is a metabolic and an endocrine disorder. And I'm sure you people are all aware of what an endocrine glands are. So like I just said, you will have menstrual dysfunctions, you'll have anovulation, and you'll have hyperandrogenism, that is abnormal hair over the face and the body. This is the normal structure of the ovary, as you can see, and this is the structure of a polycystic ovary. You have multiple fluid-filled cysts or follicles that we call, and these are what we see as polycystic. This is because there are some problems in the hormones that are being required to mature an egg to ovulate. So why do we need to know about PCOS? Now PCOS is on a rising trend. And we will see why it is on a rising trend later. And this is the most common endocrine pathology in reproductive age women. Reproductive age women are women who have attained menarche until menopause. These are the reproductive age women. So globally, the incidence is about 10%. That means every 1 in 10 women or girls are affected by PCOS. As you can see, the highest incidence is seen in Denmark and Australia, and India is not far behind. It is around 3 to 22%. And adolescents, like I said, they are also having a PCOS at a range of 6 to 10%. So what is the etiology? Etiology, you mean, what is the cause? The exact cause is not known, but it is said to be caused by multiple factors. So multiple factors could be, some have said it is because of some susceptible genes, that is the genes in our body, they could be causing the problem of PCOS. And these genes are expressed or cause PCOS only in presence of environmental factors. And these environmental factors commonly are obesity and insulin resistance. We'll discuss further. And some say even fetus exposure, that is when the baby was in the mother's womb, it was exposed to androgens. That is why it could be developing PCOS in the future. So what is the problem? Like I said, it's an endocrine problem. The problem is with the hypothalamo-pituitary ovarian axis. If you're not aware of what a HPO axis or hypothalamic pituitary ovarian axis, it is wherein the hypothalamus is located in the brain. It sends signals to the pituitary gland through the GnRH hormone, that is gonadotropin releasing hormone. And this pituitary hormone affects, after the effect of GnRH, it produces luteinizing hormone or FSH hormone. This acts on the ovary to produce estrogen and progesterone. Normally, any endocrine glands have a negative feedback phenomenon. Like negative feedback means if the levels of estrogen and progesterone are high, then it gives a negative feedback and the secretions of LH and FSH will decrease. So normally like in a thyroid hormone, if the thyroid hormone levels are high, the thyroid is producing more amount of thyroid hormone, it gives a negative feedback and reduces the amount of TSH. So that is all over all endocrine glands have a negative feedback mechanism, but only there is one hormone that plays a positive feedback mechanism, that is estrogen. This estrogen acts over the pituitary gland and the hypothalamus to produce a luteinizing hormone, LH hormone, to cause ovulation. So this positive feedback is only for 12 to 14 days. It is not many days. So it is 12 to 14 days. So when there is any problem in this axis, so that is what causes a PCOD or anovulation. Anovulation means unable to ovulate. So unable to ovulate will cause irregular cycles. That is what causes frequent anovulation. That means regular anovulation is what causes polycystic ovarian disease or syndromes. So this is the normal menstrual cycle. Like I said, FSH acts in the first half of the cycle. And when the FSH is acting, the follicles are growing in size and they mature into dominant follicle. This dominant follicle gives the estradiol, which causes release of luteinizing hormone. And this luteinizing hormone causes ovulation, and this ovulation later leads to production of progesterone, and later it causes the menstrual cycle. So this ovulation is what not happens during PCOS. So what happens is the follicles stay back like this in this stage, the primordial follicles. They don't develop into dominant follicle. That is why you have what is known as polycystic ovarian disease. So let's look at insulin resistance, which causes another way of causing PCOS. So what is insulin resistance? Insulin resistance is when the tissues in our body are unable to act with the insulin that is secreted in our body. That means the amount of insulin that is acting on the tissues will not produce the required changes. The required changes, insulin's action, main action, as you know, is to shift the blood glucose or the blood glucose from the bloodstream into the cells. And this is not happening. So because the tissues are resistant to insulin, what happens is there's extra insulin being produced as a compensatory to cause to decrease the blood sugar levels. So this is compensatory causes high insulin levels, and these high insulin levels cause the ovaries to produce testosterone. What is testosterone? It is a male hormone. And this interferes with the follicular development, and this prevents normal ovulation. And that means the woman does not have ovulation. And so she has irregular cycles and she will have weight gain. And this irregular cycles and weight gain will again aggravate or again cause insulin resistance. So the cycle goes on and on. So what are the common signs and symptoms? Most commonly, like I said, because the male hormone levels are high, the woman presents with hirsutism. Hirsutism is abnormal facial hair or any body hair. Hair loss, that the women or girls lose hair, and they will have oily skin and acne. Like I mentioned previously, that they will have obesity. And of course, this is one more sign that most people tend to neglect, that is called as acanthosis nigricans. These are dark pigmented skins that is seen in the skin folds. Most commonly, that is seen at the nape of the neck, at the back of the neck, or in the axillary fold, below the breast, in the groin area. This is one of the signs of hyperinsulinism or insulin resistance. The most common symptom which most girls will report to in any OPD is irregular periods. So let's see what these irregular periods are. How do you define them? So the menstrual dysfunction or the abnormality in the menstrual function is what we see in PCOS is oligomenorrhea. Oligomenorrhea is irregular cycles. That means the cycles are infrequent. The gap between each period is longer. So the longer the cycle, this is called as oligomenorrhea. Mostly the longer periods are more than 35-day cycle. Sometimes some girls will have very infrequent cycles, that is even less than 8 menses per year. So either if the cycles are longer than 35 days or less than 8 menses cycles per year is called as oligomenorrhea. You are aware that normal cycles length is between 21 to 35 days. And the luteal phase, that is the phase from ovulation to menstrual period, is 14 days typically for all women and girls. Then adolescent girls are girls who have just attained menarche, that is just matured, they started their first periods. So within the 1 year, they will most commonly have irregular cycles. But 1 to 3 years later also, after menarche, most girls will have irregular cycles, that is less than 21 days or more than 45 days. This is because the HPO axis is immature. Like how every person who learns the cycling, they have difficulty in cycling the first time. So similarly, the cycle when starts in our body, it will have difficulty in setting itself and running smoothly. So that it takes about 2 to 3 years for the cycle to set. So the HPO axis matures after 2 to 3 years, and only then they have regular cycles. So any young girls who have irregular cycles 2 to 3 years after they attain menarche or start their periods, you should not panic. Then hyperandrogenism. Like I said, the male hormone levels are high. So I said hirsutism. The word hirsutism is when the terminal hair, the body hair is dark and coarse and thick. So this is what is called as hirsutism. Around 60 to 70% of girls and women with PCOS will have hirsutism. Hirsutism, like I said, is graded by a modified Ferryman-Galloway score. Depending upon the amount of hair and the places where they have, we give a total score. Like the areas that are considered are upper lip, chin, chest, upper abdomen, lower abdomen, arms, lower back, upper back. So this is hirsutism, abnormal body and facial hair. Then because of high androgen levels of male hormones, they tend to have acne and even hair loss. Then you have to know what is biochemical hyperandrogenism. That is, sometimes the woman may not have any features of hirsutism or any hyperandrogenic states. They might have high androgen levels in the body, and this can be detected only on blood tests. In a normal woman, the androgens or the male hormones. So we think, what are male hormones doing in a woman's body, a female's body? So male hormones are required for bone density, to increase the muscle mass, and also for sexual functions. So the amount of androgens or the male hormones that are secreted in the females are 25% is by the ovaries, 25% is by the adrenal gland. Adrenal gland is a small gland above the kidney, and 50% is by the peripheral tissues, that is the skin and fatty tissues. But in PCOD women, the male hormones, the androgens, are secreted more by the ovary. So the primary sources, more than 50% is by the ovaries. This is because there is no ovulation, and all the small follicles that have not that are not maturing, they tend to produce more of androgens. So you think how are male hormones formed in the female body? So for any hormone, any sex hormone, the base is cholesterol. That is why cholesterol is important in our diet, but not in excess. And this goes through a pathway wherein the androstenedione is the common base, from which either estrogen, the female hormone, or the testosterone, the male hormones, form. So how do you diagnose a PCOS? PCOS is diagnosed by presence of any two of the three criteria. So in the two criteria, first criteria is menstrual disturbances, that is chronic anovulation. Then you have hyperandrogenism, that is clinical or biochemical. Clinical, I said, abnormal facial or body hair. Biochemical, in blood tests, they have more of androgens. And polycystic ovaries detected on ultrasound. So as I explained earlier, diagnosis is by exclusion. You should always rule out other disorders causing problems of the menstrual function or problems of hirsutism. If the other problems are ruled out, only then we can attribute it to PCOS. So out of these three criteria, any two criteria are important to diagnose PCOS. So let's see how we see that. So in an ultrasound, how do you diagnose it as a polycystic ovary? In a polycystic ovary, in an ultrasound, which is done in a transvaginal route, you should see at least 20 or more immature follicles in at least one ovary. And most of these follicles will be measuring 2 to 9 mm in diameter. They won't be more than 1 centimeter. So less than 1 centimeter follicles, more than 20 follicles in an ovary, or the total volume of the ovary is more than 10 cubic centimeters. Then biochemically, like I said, the androgens that are detected are elevated free testosterone is the most important hormone that has to be detected. In some women, the testosterone may not be elevated, but they might be having obvious facial hair and body hair. Then you have to test for the other hormones like the androstenedione and the dehydroepiandrosterone sulfate if the testosterone levels are normal. So other workup measures that you need are, like I said, other causes of abnormal menstrual function. You have to do these tests. Suppose a woman is not having period for many months or then you have to look for serum HCG levels to rule out pregnancy. Then you have to look for thyroid function test to see if there's having any hypothyroidism or hyperthyroidism which is delaying her periods. Hyperprolactinemia for any prolactin levels. And free testosterone for any androgen levels. Then you have to see why are the women having hirsutism. For that you have 17 hydroxyprogesterone levels and 24-hour free urinary cortisol. These are for Cushing syndrome and congenital adrenal hyperplasia. These are some of the to rule out some of the other causes of hirsutism. And in some girls, they might be in primary amenorrhea. They must have become 16 years or 18 years of age, but still did not get the period. That is when you need to do a karyotype to see if the girl is having any chromosomal abnormalities. Then these other workup here that I have mentioned, that is oral glucose tolerance test, I'm sure you're all aware. This is required to rule out other comorbid conditions like diabetes and dyslipidemias. High lipid profiles, high lipid levels are detected by lipid profile. So what are the differential diagnoses? Like I've already said, congenital adrenal hyperplasia, wherein the girl will have amenorrhea and they will have hirsutism. Then some drugs, some medicines like danazol, which will also cause amenorrhea and hirsutism. Then hypothyroidism, hyperthyroidism, thyroid problems will cause polycystic ovaries and also will cause menstrual disturbances. Then tumors of the ovary, like adrenal gland tumors and ovarian tumors, which will cause hirsutism and even cause menstrual disturbances. Cushing syndrome is another cause of obesity and hirsutism. Then hyperprolactinemia, like I've already mentioned, that causes irregular cycles. Acromegaly and other steroid usage. These are the differential diagnoses. So how does it affect in your daily life? In your daily life, like I said, obesity, like we have seen with insulin resistant, the girl is will tend to have obesity. They will have heavy cycles and infertility. Married girls will find difficulty in getting pregnant. Endometrial hyperplasia, women who are about 30 and 40 above, because of long periods of anovulation, they might tend to have endometrial hyperplasia, wherein the endometrial layer, the inner layer of the uterus is thickened and might cause heavy bleedings and other problems. Then because of obesity, the girls might, the women might develop sleep apnea, difficulty in sleeping, like they will have sleep disturbances, they will not have adequate sleep. So in the daytime, they tend to sleep more. And women who get pregnant with PCOS will have pregnancy complications like gestational diabetes, then hypertensive disorders in pregnancy. They might have premature deliveries, they might have fetal growth restrictions, and sometimes pregnancy losses also. So the other side of the complications generally that you see in PCOS women or girls are impaired glucose tolerance, that is seen in around 30 to 40%. That is why we have to check oral glucose tolerance test, and it has to be repeated every year, even if it comes normal. And you have, they might tend to have type 2 diabetes mellitus, high blood pressures, high cholesterol levels. Like I said, mostly the cholesterol levels that are affected are triglyceride levels and low density cholesterol lipoproteins. Then metabolic syndrome. Metabolic syndrome is a cluster of disorders that is seen in PCOS girls. Obesity, then high cholesterol levels, impaired glucose tolerance, and PCOS. These all together will cause a metabolic syndrome. Then you have non-alcoholic fatty liver disease, or also called as non-alcoholic steatotic hepatosis. This is also pretty common. Most of the obese girls who undergo scan in the recent times, you will see they will have fatty liver, not girls and women. So fatty liver is on the rise. This is because of polycystic ovarian diseases, then heart disease, then cerebrovascular accidents, and even finally, the girls with PCOS are more likely to develop endometrial carcinoma. Then coming to the mental health, due to the irregular cycles and due to the obesity and infertility and sleep apneas, the woman or the girl is most stressful. They have low self-esteem, depressions, mood swings, decreased work output, and of course, suicidal tendencies. So let's talk about obesity a bit. Obesity is measured by increased body mass index and of course the waist circumference. A normal BMI is between 18 to 25 and anything above 25 is overweight or obesity. These people are at a risk for hyperandrogenemia, that is higher androgen levels, and metabolic disorders. Like I said, oral GTT has to be conducted when first consulting the doctor and they have to be rescreened every 3 to 4 years. And you should also ask exclusively for sleep apnea, obstructive sleep apnea, because the woman or the girl may not be aware they are having obstructive sleep apnea. So you should ask her whether she feels sleepy in the daytime, and if she snores a lot, if she's not getting good sleep, is she having to wake up in middle of the night? So obstructive sleep apnea is nothing but, if you have noticed some people when they're sleeping, they suddenly you feel they have stopped breathing and they become silent. And after a very long spell, they take a deep breath and then they start breathing again. These are apneic spells. This causes poor quality of sleep. So the next day morning, they tend to sleep more in the daytime and their work and their academic performances are affected. So for such people, you have to do sleep studies and they have to take treatment. Metabolic syndrome, I've already explained, seen in about 43% of PCOS girls. The abdominal obesity is high in these people, with the circumference, waist circumference being more than 35 inches. And dyslipidemia, like I said, HDL cholesterol is low and triglyceride levels are high. Blood pressure is high. And the elevated level of CRP, that is C-reactive proteins, and there's a more prothrombotic state, the more chances of getting thrombosis, that is blood clots in your vessels. So PCOS is actually a lifestyle disease. So why is it a lifestyle disease? When there was 4 to 12 weeks of dietary restriction, endocrine parameters and the metabolic parameters have been markedly improved. And there was if a weight loss of 2 to 5% was achieved by PCOS girls and women, there was a reduction in hirsutism. They resumed the ovulatory cycles. They improved pregnancy rates. They improved glucose tolerance, improved lipid levels, and even reduced diabetes mellitus risk also. If you decrease your calorie intake of by 500 to 1,000 with 150 minutes of exercise per week, this can cause ovulation. So how do you prevent this lifestyle disease? So a lifestyle disease, the prevention, as you all know, is lifestyle modification. So PCOS cannot be cured, but the symptoms can be managed. So how can they be managed? Because the management is all in the hands of the patient herself. And how can they be managed? Diet, exercise, sleep, and positive habits. So let's look at diet. What is the modification that you can do with your diet? Should have a consistent meal routine. So you should not have irregular meal habits. Like one day you eat your breakfast at 6, 7 o'clock. The next day you eat at 11 o'clock. Your lunch at 3 o'clock. So that is not. You should have a particular time and should follow a particular meal routine. You should eat a wholesome, balanced diet. And there should be seeds in your diet. The diet should be a colorful diet. We call it the rainbow diet, with plenty of fruits and vegetables, colorful fruits and vegetables. And the portion should be at least 5 portions per day. That means at least 5 times you should have fruits or vegetables in a day. Then you should have whole food like whole grains, brown rice. Then you should have lean meat. Lean meat as in not red meat. Lean meat is chicken meat, fish meat. These are all lean meats. Increased fiber. If you increase your fruit and vegetable intake, automatically your fiber intake also increases. And increase your omega-3 fatty acids and omega-9 fatty acids. This helps in reducing your bad cholesterol levels and also helps in achieving a better PCOS, improvement in your PCOS conditions. And these fatty acids, omega-3 fatty acids and omega-9 fatty acids, are high in fish, avocados, and walnuts. So what you should avoid? I'm sure all of you are aware what you should avoid. Refined sugars and carbohydrates. That is any processed food, any food from hawkers, buying from outside vendors, fast foods, and trans fat and saturated fat. Trans fats are any fats when the oil is heated for long periods of time, when the oil is reused, a deep fried food. These are all containing trans fat, and this is very bad for abdominal obesity and even for PCOS. And refined sugars and carbohydrates, you mean like cakes, pastries, and other sweets. These are all refined sugars. And processed food, like any food from the outlets, any food that is coming in a bottle form, a tinned form, or a packed form, any packed snacks, any packed juices, these are all processed food. These are all have to be avoided. Then let's look at exercise and sleep. another lifestyle modification. You should exercise at least 20 to 30 minutes per day or 150 minutes per week. You can use 5 to 6 days a week, or you can pack in 150 minutes in 3 days also. It should be a vigorous physical activity like cycling, swimming, skipping, jogging, or dancing, which is most easiest exercise. Then in sleep, there should be at least 8 hours of sleep per day, and try to sleep before 11 p.m. and wake up before 7 a.m. This is very important. And other habits are positive habits that you have to inculcate is reduce your screen time, and you should learn to socialize in person rather than on your screens and virtual socializing. Take rest because the body needs rest, and see that you don't sleep for short time because you think you're wasting time, because taking rest, it helps the body to repair itself, and it also reduces your other hypertension and impaired glucose tolerance levels. And of course, some habits like hobbies like journaling or any other hobby, gardening, something which helps you soothe you down. So the take home message, let me ask you the questions once again. Is PCOD different from PCOS? No, only the name has been changed. Is PCOS a problem of the ovary? No, it is a metabolic and an endocrine problem. Only obese girls have PCOS? No, even thin girls have PCOS. They call it lean PCOS. PCOS women cannot get pregnant. No, they can get pregnant. Like provided I said, they lose their weight, they and restrict their diet, they get a good exercise, and of course, when they take treatment. PCOS is not completely curable. Only the symptoms can be managed, and surgery is not an option. Long ago, previously surgeries were done for PCOS. Now only some women who are trying to get pregnant and they're not being able to get pregnant even with medication. Only in such women, they try to do ovarian drilling. Only in such people, PCOS requires treatment. Unmarried girls and other women who are not planning to get pregnant, surgery is not an option. Just remember, PCOS is a lifelong disease. It does not stop with just when you're young. It continues in throughout your life with many long-term complications, and regular follow-up is very much required, and management to prevent other complications. Thank you. Any questions, anything? Okay, thank you. I hope I was clear.